All right.
Okay. So let me welcome all of you on behalf of Ashish Life Science. You, as you guys are aware, that this is the knowledge sharing webinar sponsored by Ashish Life Science, especially on the important topic, that is management of hemoprotozoal diseases, with especially emphasis on the East Coast fever. And I am Dr. Amardeep, who is handling the marketing and technical part of Ashish Life Science. I sit in head office India, and you guys might be aware that Ashish Life Science is exclusive dedicated for animal health company. We have our own manufacturing unit as well as our research and development hub in Mumbai, and we are across Ashish Life Sciences across 60 countries, 60 plus countries, I would say, where we have our direct presence. Also, we have our team in Tanzania, Ethiopia, Nigeria, Uganda, Zambia, Zimbabwe, Kenya, Russia, and many more countries. We do have our offices also. So where we are doing our business. So with this note, I would like to thank you, especially the main speaker, Professor and Dr. Desi Shefferao Mereba, for for this quick short notice. He said yes, I will deliver one the knowledge sharing webinar. And thank you to Dr. Chris Bond also, who initiated and asked us for this webinar to enrich the knowledge. We know knowledge sharing is a never ending process. So Ashish Life Science is always striving to enrich our customers with all the means, with the innovative products as well as the quality products, and certainly the knowledge. So with this note, if Dr. Chris Bond, if you want to share something quick, and then we can hand over this digital platform to Professor Desi.
Okay. Thank you very much, Amadip. I don't really have a lot to share because of the stress of time. I think we have delayed quite a bit, but I just want to reemphasize that hemoprotozoa diseases in Zambia are a very important disease, a set of very important diseases that are affecting our livestock. Topping amongst them is East Coast fever. We usually have also anaplasmosis, trypanosomiasis, and babesiosis. So this webinar will be of great value to the vets and paraprofessionals that will join this meeting. Thank you very much.
Yeah, thank you so much, Dr. Chris. And just to brief about our today's speaker, his name is Dr. and Professor Desi Shefferao. He is the professor of veterinary epidemiology from the Hawassa University, based in Ethiopia. He has a degree from Addis Ababa University. He has a rich experience of 18 years, especially into the teaching in Hawassa and Voliatio Sodo universities. For the academic, he was a vice president, head of research and publication, head of the department, and instructor for various courses in Voliatio Sodo University. He has a postgraduate program. He was a postgraduate program coordinator in head of School of Veterinary Medicine. He was also a chairperson of academic staff, promotion committee, and instructor at Hawassa University. Also, he has 10 years of experience as a field veterinarian, and that makes him something unique, who has academics as well as the field veterinarian responsibility. He has more than 60 plus articles in various journals for his publications. So with this note, I would like to welcome Professor and Dr. Desi to the people, the veterinarians, the professionals across many of the territories globe have joined for this webinar. So it's our kind pleasure, sir, to welcome on behalf of Ashish Life Science for this webinar, sir. Now the digital platform is yours, sir.
Thank you so much for inviting me and giving me this chance to communicate with
colleagues from various parts of Africa. And I'm just glad to hear and to see the video of Dr. Chris Bourne. Thank you so much. As Dr. Amardeep said, I just worked as a field veterinarian. I worked in regional veterinary laboratory, which is a diagnostic laboratory. In fact, it's for a short period of time. And then I joined higher education, first Hawassa University, then Walaita Sodo University, again back to Hawassa University. And now my home base is Hawassa University. Thank you so much. And I will proceed with my experience sharing.
Sir,
only
one thing. Not only people from Africa, but people from India also are.
Yeah. Sorry.
No problem, sir.
Dr. Amardeep, honestly, I have a number of friends from India working with me, and those left Ethiopia to the home. I have a number of friends, genuinely.
Yes, sir.
So thank you. I apologize. Thank you for reminding. Thank you. And even I appreciate for those attending this webinar presentation, which is even if this platform. But what I want to remind them, if they do have questions, let they prepare and forward to Dr. Amardeep, and then I can get it, and then I can react as much as I can. Thank you.
Sure, sir.
So the major topic is management of hemoprotozoal disease, emphasizing on East Coast fever. So in general, hemoprotozoan parasites are very important, not only in Africa, in worldwide. They are just distributed throughout the world. But ECF is a major problem in Eastern Central Africa and some southern parts of Africa. Is a major obstacle for livestock development. That's why emphasis is given on ECF, I think, by the Ashish Life Science. So, what is hemoprotozoa? Those professionals like Dr. Amardeep, Dr. Chris Bourne, and the other doctors which are attending the presentation, they know the hemoprotozoan. Hemo is blood, protozoan is a single cell parasite, which is obligate intracellular parasite or in the hem, in the blood. So hemoprotozoa are blood protozoan parasites. Among these, the most important hemoparasites, the most important is Tellurium, Babesia, trypanosomes, especially in Eastern, Central, and Southern parts of Africa. Tellurium is the major one. What I mean Tellurium is the East Coast fever one. But the other one we'll see. It's distributed everywhere in different parts of Northern Africa, to China, India, some European countries. But these three are the most important concerning hemoprotozoa. So Telluriosis, when we say Telluriosis, is a common name, it's a wide name for every different aspects of disease caused by Tellurium. So we will see two of them. The first one, in short, tropical Telluriosis, and then in detail, the East Coast fever, the major concern of today's presentation. So Telluriosis is a tick-borne disease. It's a protozoal disease. It is associated with Telluria species. Different Telluria species are existing. It affects cattle, sheep, goats, horses, ungulates. What I mean by ungulates, the wild and the captive. So you know when we say ungulate, ungulates are hoofed animals. And when we say captive, those confined animals. So it is with diversified host, affecting many species of animals, which are very important and valuable for human benefit. So two major Telluriosis are known. The main one, the East Coast fever, tropical Telluriosis. People also call it this tropical Telluriosis, Mediterranean coast fever, affecting many parts, Northern Africa, Mediterranean regions, Asia, Portugal, China, India, many other European countries. So the tropical telluriosis or the Mediterranean East Coast fever, it is caused by Telluria annulata. This is a major one for Mediterranean East Coast fever. So this is majorly member of Apicomplexa. So the parasite is known as Apicomplexa because when we say Apicomplexa, the Apicomplexa is distinguished by a variety of organelles. The organelles like fibrils, microtubules. But these fibrils and the microtubules are located at one end of the parasite. That's why it is said to be apical. Apical. So that is the most important. So it is also tick-borne disease. But it's not only by Rhepicephalus appendiculatus. It is also transmitted by hyaloma species, various hyaloma species, Rhepicephalus appendiculatus, Rhepicephalus dutoni, and Rhepicephalus zambensis. Maybe Dr. Crispon, he can understand this. Rhepicephalus zambensis is commonly distributed in southern parts of the continent. So that is the most important. The transmission is majorly, all in all, is transstadial transmission mechanisms. That means from tick to tick. What does that mean? Stage to stage transmission. If the tick gets infected at the larval stage, the nymph will transmit Telluria annulata. If not only at nymphal stage, at adult stage also. If the nymphal stage gets infected while feeding blood from the host, then it transmits the parasite into the host at the adult stage. So that is the most important. So it is a stage to stage. But there is no transovarial transmission like that of Babesia that we know. It's quite different. In Babesia, we know that there is transovarial transmission. But in Telluria, there is no transovarial transmission. The major reason behind this, the Telluria is unable to penetrate the ovaries of the tick. So there is no transovarial transmission. So generally, this tropical telluriosis or Mediterranean East Coast fever, it occurs in Africa, many African countries like Mauritania, Morocco, Algeria, Tunisia, Egypt, Sudan, South Sudan, Ethiopia, and Asian countries, Portugal, European countries. Currently, many countries are affected by Telluria annulata. And generally from Morocco through the west, through the Mediterranean Sea, Middle East, India, and China, affecting many countries, even not restricted to African continent. So this Telluria annulata is a serious constraint, a serious problem, especially to the dairy industry, to the livestock production, majorly in exotic areas. The Northern Africa and the Middle Africa, Southern Africa, Central Africa, Eastern Africa. These are the exotic area where the disease is known. The so-called people endemic in medical term, exotic in veterinary terminology. So what we know, infection of local zebu, the local cattle, is sometimes subclinical. It does not mean that that clinical case never occurs. It occurs. The clinical case also occurs, but subclinical. And we know that the subclinical infection is the one that majorly affect productivity, animal productivity. So productivity is affected means gain from the livestock byproduct is lowered. But if we want to improve the breed in our area, in the local area, for milk production, for meat production, this is a major obstacle because the exotic breeds from the local area, they are highly susceptible. They manifest clinically the disease. So they are the one majorly affected They are the one majorly exposed for mortality, comparatively. So better to focus to our today's major mission, which is East Coast Fever, ECF. So it has been reported from East Africa since the 19th centuries. So it is widespread to the Central Africa. It's not only restricted to East Africa, to the Central Africa, Southern Africa, many countries now. But it's not reported from abroad or outside of Africa. Major problem in East, Central, and Southern Africa. Major, even it's not major problem in Western Africa, as just like that of the Mediterranean coast fever. This disease is first recorded in 1569 by Mancalaro, but it is not recognized as a disease. Just it is not identified clearly whether it is ECF or others, but it is just simply recorded. And then it is recognized very well late in 1904. So it is diagnosed as the disease and stated that it is originated in east part of the Africa, especially in Dar es Salaam, the first time. That's why the name East Coast Fever is given. Eastern part of Dar es Salaam. You know, Dar es Salaam is the capital of Tanzania. Yeah. That is why the name given, ECF, East Coast Fever. Then it spreads throughout. And now it is well known by veterinarians, by animal health professionals in many parts of the Africa, especially in the eastern, central, and southern parts. So the occurrence is, as I said, in East, Central, and Southern Africa. There are reports, if you just try to Google and check reports from different countries, it is reported from Burundi, it's reported from Rwanda, it's reported from Kenya, it is reported from Sudan, especially Southern Sudan. Previously, it is recognized together. The Northern and the Southern Sudan is one Sudan. Now it's clearly known, the report indicated it is from Southern Sudan. It is reported from Zambia. It's already, Dr. Chris Bourne, he mentioned it. It's a major problem in the area, especially if I am not mistaken, the northern and the southern part of Zambia is highly affected. We will see some graphs. Uganda, Malawi, and the previous Zaire is no more Zaire now. You know, it's Democratic Republic of Congo, I think. If I am mistaken, Dr. Chris Bourne can correct me because this is a neighboring country. So Zimbabwe, southern part of Zimbabwe, Mozambique, Tanzania. Tanzania is the nucleus area for the start and the spread. Because the case is first well recognized as a disease in Dar es Salaam, and then it's spread to the other African countries. This spread is because of nothing else. It's because of livestock-free movement. No diagnosis, no check, livestock movement, livestock. What I mean is livestock movement. From region to region, from country to country, from area to area within the country. That is a major problem for the spread of East Coast fever. So this is just simply, it's a map of Africa. It's a map of Africa. And I try to show with the countries with the red dots, including Zambia here, and the Democratic Republic of Congo, Zimbabwe, others, we see. I try to indicate with the red dots. These are areas where clearly currently known with the existence and problem of East Coast fever. The problem areas. Just this is a map, just to show Tellurium annulata, Tellurium parva, and Serengeti, which is found far east. But in fact, the two are major problems. The annulata is, you see, it's a major problem. Many areas. You see, the brown color. many areas, including Ethiopia, Northern Mediterranean region, many other parts. But Tellurium parva, which is the causative agent of East Coast fever, is, you see, the countries that I mentioned, most of them, is a major area where Tellurium parva is distributed. So I try to mention again the names here, the same name that I mentioned above. What is the economic importance, the economic significance of East Coast fever? So we know that the major impact is on cattle production. Cattle and the buffalo are the major animals affected in Central, South Africa, and Eastern Africa. The major economic importance of East Coast fever is days of animals. Up to now, millions of cattle died of East Coast fever. Still dying. Still dying. The death of the animals. Because the mortality of East Coast fever is 90 to 100% mortality. So the loss is very high. The second economic importance is the loss through animal breeding, through productivity. Let's say, as I said earlier, exotic breeds are the most affected, the most susceptible, easily affected. And the mortality is very high in exotic breed from the local area. What I mean exotic is maybe it varies from country to country. Not the local breed, exotic breeds that are introduced for the purpose of increasing milk production, for the purpose of increasing meat production, so and so on. In fact, East Coast fever is not reported from Ethiopia, but there is a risk. There is a risk because of free animal movement between Kenya and Ethiopia at the border. Free movement.
I guess there is this, your screen is not visible. Can you just stop sharing the screen and please reshare?
Okay, shall I leave the
No. Stop screen sharing and then reshare. Sorry that because just we got to know that this screen is not visible.
Okay.
You stop sharing screen and then restart.
Without sharing the screen.
No. Use there will be options, sir, on your screen. Stop screen sharing and then again.
Stop. Yeah. Yes.
Stop it and then reshare. Yeah. Please reshare again your screen.
Yes.
Yeah, your screen is visible now. Hope Dr. Ilyas, your the screen is visible.
What about now?
You just text if the screen.
What about now?
Yeah, sir.
Visible now.
Sir, I'm just checking because it is visible to me. Hope the participants also. Can anyone from participants just comment in question and answer session that are you able to see the screen?
Dr. Crispon is muted his microphone.
Yeah, now we can see. Thank you.
What about Dr. Crispon?
Dr. Devi, we can see the screen. Yeah. Sir, can you just go to the map again, sir, so that it will be easy for the people to understand. Just go to the map. You are going ahead. You have to go back.
Yeah.
Go back again, sir. Go back again.
This is Africa map.
Yeah, from here.
Yeah.
Sorry, sir. You can start it from here.
Dr. Roba Hassan raised hand. Yeah. You treated, yeah?
Yeah. Now they can see your screen, sir.
Okay. So the occurrence is in East Africa, Central Africa, southern part of Africa, including those countries, because there are reports from Burundi, from Rwanda, from Kenya, from Sudan. Now there are two Sudans, you know. The southern Sudan is with this problem, East Coast fever. In Zambia, in Uganda, Malawi, the previous Zaire, and the current Democratic Republic of Congo. And in Zimbabwe, especially southern parts of Zimbabwe, Mozambique and Tanzania. These are areas from where there is report by different researchers, different academicians reported the case of East Coast fever. So if we see this in the map of Africa, the one that is with red dots in different countries, these are from where report of ECF, either in published form, either in report form, is available. And if we see the dots, the South Sudan, the Kenya, the Uganda, the Burundi, Rwanda, and Malawi, Zambia, Zimbabwe, and Mozambique with the yellow. Other scar also exists. Still, there are reports from different parts. That is for East Coast fever. But if we take this world map, and if we look for Tellurium annulata, the one which causes tropical Telluriosis or Mediterranean coast fever. So it is distributed throughout Northern Africa, Mediterranean region, European, Asian, so and so on, many countries. But Tellurium parva is restricted, as I said, you see, these areas. Those countries that I mentioned, Kenya, Uganda, Tanzania, Zimbabwe, Zambia, so and so on. So these are the area where the major problem of East Coast fever is existing. In Ethiopia, there is no report of East Coast fever, but there is tropical Telluriosis, no doubt. A number of reports are existing. Ethiopia is also affected by Mediterranean coast fever, but still there is no East Coast fever. But there is a risk because there is a free movement of cattle from the northern Kenya to the southern part of Ethiopia. There is a free movement because of that area is a pastoral area. So in pastoral area, we know the movement of the animal is free, uncontrolled. Because of that, there is a fear for the introduction of East Coast fever, especially to those pastoral areas. There is a fear, even if there is no report. The major economic importance of this East Coast fever, and before that, what I want to say here in this map, majorly the distribution, the occurrence of Tellurium parva is generally in line with the vector tick. The vector tick is Rhipicephalus appendiculatus. And to my understanding and to my knowledge up to now, there is no report of occurrence of Rhipicephalus appendiculatus in Ethiopia. That's why East Coast fever is not reported. I myself, I did more than 2-3 times on ticks. I tried to investigate many tick documents, many tick articles published from Ethiopia. There is no Rhipicephalus appendiculatus. In those countries that I mentioned, Rhipicephalus appendiculatus is highly distributed. That is the main vector tick for Tellurium parva transmission. So the economic importance of East Coast fever is 4 major areas. 4 major areas. The first one is deaths of millions cattle. Up to now, millions cattle died in Eastern Central Africa because of East Coast fever. Still dying because of East Coast fever. This is one loss. The other is serious loss is encountered in exotic cattle. We are introducing many times exotic cattle for improving milk production or increasing milk production, increasing meat production, because they are highly productive. So if we are introducing exotic cattle from the local areas, cattle adapted to the local areas, from the Nave area, East Coast Nave areas, if we are introducing, so they are the one highly affected. By the way, East Coast fever causes 90 to 100% mortality. high mortality in exotic breeds. It may be a bit low in local breeds. The other one is the cost of treatment by the farmers. It's not simple cost. Tick treatment, sick animal treatment, you see? These are the major losses. And there is sometimes sanction on cattle trade, inhibiting cattle movement. I remember when I was undergraduate students at Addis Ababa University, there was a debate on we will not introduce animals from Kenya. No, we have to check, we have to examine, we have to look, we have to diagnose, and then we can introduce. No, we never do that because of fear of Tellurium. But we know that the Borna cattle is very nice, wonderful for meat production, quality meat. So that is another problem related with Tellurium in terms of economics. So East Coast fever is a protozoal disease, which is a serious that causes 90 to 100% mortality, but it's not contagious like the other diseases, because the causative agent is obligate intracellular parasite, obligate either in the vector tick or in the mammal host. That means cattle and the buffalo. So the major cause is Tellurium parva. That's what I mentioned repeatedly in the phylum Apicomplexa. I try to mention what Apicomplexa means. So it is obligate intracellular protozoan parasites. Majorly, it affects cattle and the buffalo. But Tellurium annulata affects the other source. But this one, majorly cattle and buffalo. So the transmission is by Rhepicephalus appendiculatus. This tick is brown tick in color. It's majorly found around the ear of the animals. That's why it is said to be brown ear tick in cattle, in buffalo. Easily identifiable. And the transmission is, as I said, it is trans-stadial transmission mechanisms. No trans-ovarial transmission, no. Because of inability to penetrate the ovaries in ticks, not in the host, in the mammals, in ticks. So what we mean by trans-stadial, to repeat what I said earlier, if the tick developmental stage, especially the larva, infected, it will transmit the disease at the nymphal stage or at the adult stage. You see? But if the nymph gets infected, then it transmits the disease at the adult stage. That is what we mean by trans-stadial, stage to stage, from nymphal stage, from larval stage to nymphal stage, from nymphal stage to adult stage. You see, when they are developing while sucking blood for their meal, they will get, because the larva, the nymph, the adults are the ones that suck the blood from cattle, from buffalo. And this tick is majorly three-host tick. What we mean by that, just Dr. Chris Bourne and the others will understand me very well. The adult female feeds the blood and drop to the ground, to shade areas where it's suitable, lay eggs, then the female will, the female tick will pass away, the others will develop to the nymphal stage. So the larva stage. The larva climb to the cattle or buffalo to feed blood. After feeding and engorged with blood, the larva will drop to the ground. Then after certain periods, molt to nymphal stage. The nymph again climbed to another host, cattle. Feed on blood, engorge it, and then drops. Then it molts to adult. In such a way, when the larva climb, gets blood from the affected cattle, the nymph will ingest Tellurium parva together with the blood of the animals. Drop, molt to nymph, and when the nymph jump to another host, inject the saliva into the animal blood vessels, just that saliva to protect blood clotting in order to blood flow to the ticks freely. Then, together with the saliva, the tick will inject the developmental stages of Tellurium parva into the host. Then it will engorge it with a blood drop. In such a way, the cycle continues. So, in fact, the tick will inject the sporozoid stage. We will come to the life cycle next. But East Coast fever is not contagious. It's not contagious like the others because it is vector-borne disease. So this is a tick, easily identifiable. You see, the rhipicephalus, the male part, in male, you see? Look here, easily visible. And the festoons are here. But by looking this structure, which is absent in other rhipicephalus species, you can identify the existence of Rhipicephalus appendiculatus in the area. In fact, it is widespread. It's not confusing. And this one is the male one, and this one is the female one. By looking the male end part, the vent part, easily you can identify. This is a dorsal view. It's not the ventral view. So easily it can be identified. So this is a tick that is playing a major role in the transmission of East Coast fever or the causative agent Tellurium parva. And this is maybe it's not very clear. Just I can mention orally. What will happen? The tick containing the pathogen, Tellurium parva, developmental stage, especially sporozoids. When feeding from the both taurus, both indicus, local animals or others, the tick will inject sporozoids into the blood of the animal, the host. Then that will be captured by white blood cells, especially by the lymphocytes. Once it is captured, it develops in the lymphocytes, in the lymphoblasts, into macroschizontes. Gradually develops into microschizontes, two forms of the schizontes, macro, the larger, and micro, the smaller. Then the microschizontes, when the blood bursts, the microschizontes are released in the body of the mammals. Then the microschizontes enter into the red blood cells. Now they become pyroplasm, the pyroplasm form. Different forms, some coma-shaped, some circular, some like stick-shaped. Various forms of pyroplasms are in the red blood cells. Now, when the tick is feeding on the blood of the animal, the host, the mammals, then the tick will take the pyroplasms in the red blood together with the red blood cells. Now, development will start in the gut of the tick. You see? No more in the mammal host from here. Now it is developing. Zygote formed, kinate formed, sporogony takes place. The so-called asexual reproduction. It's not sexual, asexual reproduction takes place in the tick gut. Zygote formed. Then the kinate is released. Infected nymphal and adult stage can be possible. Here, either the nymphal stage, the larval stage, the adult stage will take the blood with pyroplasm. Now, the nymphal stage, when climb to another host and feed on blood, then they will transmit. By the way, with the blood, pyroplasm in the blood taken by the larval stage or by the nymphal stage or by the adult stage while feeding on blood. Then the nymphal stage molt on the ground, but still the Tellurium is developing inside. Then after molting, it climbs to the animal. Which stage? The nymphal stage. Then the nymphal stage, while taking blood, transmit to the host. In such a way, the cycle will continue. But The sporozoids are the ones that is transmitted with the saliva of the tick to the host. So what are the risk factors in general up to now? The major risk factors is the presence of Rhepicephalus appendiculatus. If there is option to eradicate Rhepicephalus appendiculatus, I hope we will be free from East Coast fever. But the major problem is the risk factor for East Coast fever is the presence of Rhepicephalus appendiculatus in the area. The major risk factors is the animal factor. Young and indigenous breeds are less susceptible. The young is because of immunity through the cholesterol from the dam, the mother animal. And the exotic breeds are highly susceptible, as I said, because they are naive for the Tellurium parva in the area. So they are easily susceptible, easily affected. Forget the European breeds, even the African breeds, if you import from East Coast free area to East Coast prevalent area, those animals are highly susceptible. Highly susceptible. The other one is animal immunity, level of immunity. Immunity can develop in different ways, through vaccination, through infection. So, vaccination is available. I know that for Tellurium parva in Eastern, Central, and Southern Africa, it's practiced. So, sick and recovered animals will develop immunity. But that immunity is immunity to homologous challenge. And that immunity is not sterile immunity. So you understand me what I mean by sterile immunity, because sterile immunity is common in trypanosomosis also. When we say sterile immunity, as opposed to this one, that means sterile immunity, it results in elimination of the microorganisms or the pathogens. So it is characterized by absence of disease and absence of circulating pathogens. That is sterile immunity. But in cases of East Coast fever, no sterile immunity developed. What do we mean by non-sterile or no sterile immunity? It is characterized by absence of disease. Disease will not there. Disease will not there. Will not be there. Disease is not there in general. Will be. Disease is not there. But there is circulating Tellurium in that animals. No disease manifestation, no clinical manifestation of the disease, but circulating pathogens in the blood is possible. That is true for many other protozoal diseases, true for Tellurium parva also. So that is what we mean by non-sterile immunity. After recovery, non-sterile immunity, but there is no clinical disease. No clinical disease. The other risk factor is the environmental factors, which is very suitable for the tick multiplication. The tick life cycle. If the area is suitable, the tick will multiply very fast because the environment is very conducive. The season is very conducive. So care should be taken when the tick population is increasing to apply acaricide. Care should be taken. It's not always strategic acaricide application. We will come to the control part later, in fact, but we have to know when the tick population is tremendously increased in that area. Season should be known. That is a factor. When high number of larvae, high number of nymph, or high number of adult ticks infesting the host animal. And that will give chance for transmission, high transmission, fast transmission of Tellurium parva. So that should be known. Care should be taken. So the clinical sign, maybe it's not for you, the professionals, but for those others, if there are farmers participating. I think Dr. Amar, there are some farmers participating.
Yeah, there are few.
Yeah, so I have to just say some clinical sign of East Coast fever.
Please.
Even if they know from indigenous knowledge, let me say some pointers. So the incubation period after infection will take about 3 weeks, 1 to 3 weeks. But these 3 weeks it depends on at least 2 factors. One is the challenging dose of Tellurium parva. What is the size of infecting dose, the amount injected? The other one is the virulence of the strain of Tellurium parva. Nowadays, there are some strains of Tellurium parva existing. These 2 factors will affect. But generally, what is observed is fever is the first symptom. Why fever? Because of entry of Tellurium parva in the blood of the animal. So fever is the most important. When there is fever, no doubt that the animal gets depressed. Not only depressed, the animal appetite goes down because of fever. So we know from in human being, whenever we feel some chill, some fever, we are not willing and we are not happy to eat. You see? Their appetite will go down. If appetite goes down, the animal gets weak and the weakness will develop. Because of that, there is a wasting of the body. Emaciation will follow. Drop in milk production, drop in meat production is sequentially followed. And in the meantime, the lymph node, superficial lymph nodes become enlarged. I'm not talking the inside, because externally, what we can observe in the animal. So the lymph nodes enlarged, superficial lymph node, parotid lymph node, prescapular lymph node, prefemoral lymph nodes, easily visible by the veterinarians. That's used during clinical examination. So this is common. So later stage, some discharges, some lacrimation, tearing observed, some discharge, dyspnea, even difficulty of breathing. Sometimes when just the final stage difficulty, asphyxia will develop. But before asphyxia, during dyspnea, the animal becomes recumbent, falling in one side because of wasting, unable to withstand anorexia, wastage, weakness, then recumbency will follow. When the dyspnea goes on because of secretions and the discharges, asphyxia will develop, unable to get oxygen, unable to get air, then that will lead to death. But sometimes there is possibility of involvement of the brain. When brain tissues are involved, circling movement can be observed. That's why in the southern part of the continent, they call it turning sickness. They call it turning sickness. That is whenever brain involved. So the terminal stage, at the terminal stage, diarrhea will follow. But that diarrhea might be with dysentery. Not necessarily might be. Might be there is a blood or no blood in the diarrhea. There is a possibility for absence of blood, presence of blood. Just this diarrhea is a later stage of the disease, later course of the disease. It's not early. So that's the most important. So back to what I said, whenever there is brain involvement, what we call turning sickness, that is the cerebral telluriosis. Just right at that moment, the nervous clinical manifestation will be observed. Convulsion, tremor, profuse salivation, head pressing down, all these things started to be involved, to be observed because of the cerebral telluriosis. So that is, there is a possibility. Such reports are not from Kenya, around Kenya, and around Malawi, not Malawi, Rwanda, Burundi. Maybe in the southern area, maybe Dr. Chris Bourne, he can comment later, observe it, whether it is observed in the southern parts of the continent or not. So these are just to show for those animal owners, farmers, and maybe if there are some technicians, these are some of the visible lymph nodes. Sometimes these popliteal lymph nodes can be visible easily. This is a prefemoral that we know, and this one is the prescapular lymph node, and this is the mandibular. It can be palpated, and also the preparotid, just immediately below the ear. It can be easily visible. These are the superficial lymph nodes. So easily by looking at this, then taking temperature, then the animal health professionals can proceed for the other examination. Just this is a parotid lymph node. I take this picture from internet. This is, you see, it is swollen. Here is the ear, right side of the animal. Here is the lymph node. Is highly swollen, highly swollen. Even it becomes 3-4 times larger than the normal size. 3-4-5 times. Again, here also, tearing of the animals. In fact, tearing can be observed not only in the cerebral tellurosis, but in the others also. Because of the fever, tearing will come. Because of dyspnea, tearing will come. So that is the most common. The most common. This is an animal died, just to show you the picture. Otherwise, is common. Being there is no Telluria parva in Ethiopia, no so far reported. I took it from internet, to be honest. So how to diagnose any guy? So the first point for the diagnosis is major. The first point is to know the history and the distribution of Rhipicephalus appendiculatus in the area. Is there a vector tick in the area? We have to be sure. If the tick vector Rhipicephalus appendiculatus is not in the area, we have to suspect Telluria annulata rather than Telluria parva, because it is widespread. In fact, it is not so much common in the southern parts of Africa. So you observe the clinical sign on sick animals. You check the vector on the sick animals presented to the clinic or complained by the owners. After that, doing the major clinical examinations, palpation, pulse, temperature, so on and so on. You know the clinicians very well. After that, you take blood sample. What we said earlier, if you remember, the macroschizons are found in the lymphocytes. So we have to examine the lymphocytes, and the care should be taken at that time to not confuse with the nucleus of the lymphocytes, because nucleus and lymphocytes are white blood cells. They are nucleated. So care should be taken to not confuse with that. Taking the blood, staining with the GIMSA, you examine schizontes, macroschizontes in the lymphocytes, pyroplasma in the red blood cells, which are with various shapes, but both by GIMSA stain. It's better to take biopsy from the lymph node, those enlarged lymph nodes, by puncturing with the needle. Take using the plunger, just you suck from the lymph node, make the smear, GIMSA stain. You check for the lymphocytes, the cytoplasm of lymphocytes. Is it only the nucleus or something else? Or just take the blood, circulating blood from the ear vein. Just you make the smear, stain it with the GIMSA, the same. Then you examine for the various shapes of pyroplasms, because this is not confusing. In the cytoplasm of red blood cells, there is no nucleus, no confusion. If there is something odd with different shape, undoubtedly it is pyroplasm. And the shape of the pyroplasm is even different from that of the Babesia shape. We know the Babesia shape. So that is the most important. So it is the most important. If there is a facility, we can conduct serological tests, different serological tests, different and molecular tests like polymerase chain reaction, if we have the facility. I think at clinic level, these three are enough at clinic level. At research level, serological tests, molecular tests can be enough. If the animal died, we can conduct post-mortem examination by the veterinarians, just inviting veterinarians post-mortem examination. But At farmers level, this is the most important. The first one, observation of clinical sign and vector.
Yeah, and
Search.
one more point, if you allow, sir, I would like to add, like when we diagnose these cases, correct me, sir, if I'm going wrong. Like
What?
correct me. I want to just add one more point where you already covered that point, but still I want to add or emphasize on that point. Correct me if I'm going wrong. Like when we diagnose these cases, certainly, sir, as you said very correctly, at field level to diagnose these kind of cases is a bit different, whether using the molecular or serological tests. So we have an aid where first thing is that the swelling of lymph node we can see and the temperature. But whenever the temperature is not responding to any of NSAID or any steroidal drug, because whenever we try any NSAID or steroidal drug, we can find that within 24 hours or within 24 hours, usually the temperature goes down.
Yeah.
But after using those drugs also, if temperature is not going down till 24 hours, then it's something different. That is one of the diagnostic tool. As certainly it is a preliminary, but we may have a suspected kind of cases for this, isn't it? Sir?
Yeah. As you commented, as you added the information, treatment diagnosis is also possible.
True.
You treat with the appropriate drug.
That is also diagnostic.
If you suspect drug against Tellurium parva and see the progress. Is there some change within 12 or 24 hours? Most of the time within 12 hours, rather than giving extended time. If it responds, then you can suspect that it is ECF. So it is also possible at field level. Otherwise, the serological tests, molecular, I think serological tests, if there are neighboring regional laboratories closer to the area in the country, it's possible to collect blood and to send serum to the laboratories for more confirmation. Otherwise, molecular test is just for research purpose.
True.
That is what you said is quite right. And this is just some stain, blood stained. This is where the red blood cells, blood smears. You see inside. In fact, when the PowerPoint is shared for you, you will get it. You see, these are with the different shapes of Tellurium, but this one is lymphocytes smear done from lymph node. So the schizons are larger, and it's easily identified. You see here, there is no two nucleuses for a lymphocyte, a single nucleus. That's what we know, and others, and more can be seen. So that is why we said earlier it is intracellular. Here also it is inside the red blood cells. You see, it's obligate intracellular. So this is possible. Gene sustain is very simple. It's a friendly use in the field. Again, another, maybe more clear. You see, it's common. So in red blood cells, the pyroplasms are common. Again, 2-3 pyroplasms inside with the arrow. Again here, it's common. In fact, this is for annulata. So what we have to take care, some diseases confuse us or the farmers or the animal owners with some diseases, with East Coast fever. Just that is because of sometimes development of fever. Fever can develop because of various diseases in livestock, in cattle. And the lymphadenopathy, increasing of the size of lymph nodes, superficial lymph nodes. It can increase or enlarge it because of different reasons. Anemia, depression. Whenever there is fever, the animal gets depressed, no question. It can be because of different diseases. Just as a sample, what I try to indicate, tropical telluriosis, the Mediterranean East Coast fever, hair to water, trypanosomosis, babesiosis, malignant catarrhal fever, others also. They may be manifesting by fever, lymphadenopathy, anemia, depression. So care should be taken. What we have to do in such conditions, we have to check for the tick, the vector tick, Rhepicephalus appendiculatus. And what I am now hesitating, for example, in Ethiopia, southern part of Ethiopia, to conclude there is no East Coast fever, we have to again conduct survey investigation for Rhepicephalus appendiculatus, not for the Tellurium. We have to look for the vector tick. Seriously, especially the southern part border. Then we can confirm. So all this can be confirmed based on looking the animal body, especially brown ear tick around the ear, because that is the predilection site of the tick. And based on that, we can identify. And we can do gymnastic by taking blood film. Trypanosomosis can be easily identified. Hair to water is manifested by other clinical signs like circling. In fact, in those areas where ECF is existing, it may confuse the cerebral terroris is existing, it may somehow confuse. Otherwise, we can take blood smear. Babesia is very easy. Just we can look for the urine of the animal. Is it with hemoglobin or free? Clean or turbid? So such conditions can be concluded, and the local animals should be advised just through animal health extension. So to differentiate knowledge of the disease history in the area, lymph node or blood smear examination is helpful, very helpful, because the epidemiology of East Coast fever occurrence is related with the presence of Rhepicephalus appendiculatus. Still, it is not reported with the other ticks. Maybe if there is some new information from Zambia area, Dr. Chris Bourne can comment on that. But to my knowledge, the vector is Rhepicephalus appendiculatus. This is a major vector, the major vector. So for the treatment, what shall we do? East Coast fever. Different drugs are now available. And what I would like to appreciate, Ashish, is not only expanding their project areas, just they are helping the community, the animal owners, through developing new drugs. You see? New drugs. For example, look, Butacur. The Butacur is very effective drug. Effective drug. With the Tellurium annulata, it is reported from different areas. It's very effective for the treatment of telluriosis. If not only for Tellurium parva, even including Tellurium annulata, the tropical telluriosis. Butacur is very important. So you can just browse and you can visit their websites. Different products are there. But for my presentation, I know Butacur is the most important for Tellurium parva, Tellurium annulata. And the Diminashish is very important for Tellurium annulata. You see? Very simple. Just the preparation can be used in intramuscular injection, which is effective against Tellurium annulata. You can dissolve it in 15 ml distilled water. So it is sufficient for up to 300 kg weighing animal. Very effective. What I can 100% assure you that it is used for other protozoal disease treatment, for trypanosoma treatment, for babesia treatment, not only for Tellurium annulata. So these are the most important. And for the tick control, also you have to use acaricide. And what I just finally, before the treatment, before the control, what I can assure you is that for the control, for the treatment, acaricide can be used for the treatment of intermediate host, the intermediate host for Tellurium parva. And again, you can use for telluriosis another option, Martrip, which is presented in different forms, in 100 ml, 50 ml, so and so on. The others are also the same. But in fact, this one is presented in sachet. So it is dissolved in 15 ml. And this one is in bottle, you see? So it's injection form. So single injection, which is 5 ml per 100 kg. Depending on your animal size, you can adjust the amount. Single injection is enough. If necessary, after 2 weeks, something like that, you can just repeat the treatment. And the control, because that the intermediate was the vector tick is, I want to treat it under the control. The control and the prevention is majorly knowledge of the distribution or prevalence, and epidemiological determinants are the most important. Those that I said, the risk factors for ECF or tropical terrorisis. So it is crucial to design and implement effective control measures. The main method of East Coast fever control is to break transmission cycle. Breaking the transmission cycle is the most important. Break the transmission cycle is possible between cattle and the tick. If we break that, it's being obligate parasite, intracellular parasite, no such problem will exist. For that, options are there. Vector control, the tick. So acaricide application is the most important to prevent the tick challenge. But widespread and strict application of acaricide is recommended. Wisely application is good. Strategic application is good. This is why wide and strict application is recommended to avoid acaricide resistance by the tick. Colleagues, now continental and worldwide, the major problem is the development of drug resistance, acaricide resistance for GIT nematodes, anthelmintic resistance for bacteria, anthelmintic resistance. This is a major problem. So to avoid that, widespread and strict application is the most recommendable. Immunization of the cattle. Two alternatives are there. I don't know which one is practiced in Zambia. Infection and then treatment is one. Again, there is also availability of live vaccine. And most people prefer infection and treatment method. So that is practiced in various parts of Africa. But what we have to do, we have to isolate sick animals to avoid climbing of ticks in the field. If we let them in the field, then tick will get them, take the blood, then drop, climbing to healthy animals, transferring Tellurium. And as much as possible, we have to isolate those animals and we have to treat them. We have to treat them separately and we have to isolate them. And acaricide application to these animals and to the other animals, just to avoid Rhipicephalus appendiculatus, is very nice. Restriction of cattle movement, especially restriction of cattle movement from ECF infected areas to healthy areas, free areas, is the most important. The most important. What I advise you is more sustainable and reliable method is to use combination of strategic tick control and vaccination. The combination is more effective, more sustainable, more reliable, rather than focusing only on one. Vaccination combined with application of acaricide to control tick. And as I said, there is a very good acaricide is available. The external parasitized parasiticide is the most important. Here, ashimetrin, 6%, which is in the form of poron, is available. 10 ml per 100 kg body weight. Just you can apply on the middle back of the animals. Then it will cover the rest parts through time. You see? This is important not only for Rhipicephalus appendiculatus, for others also, for other ticks, for other insects, flies, glossina, sucking lice, chewing lice. You see? Because lice are already permanent ectoparasites. They are living on the animal. It's not like flea. So it's important not only for Rhipicephalus appendiculatus, but for the other ectoparasite challenges. So this is available, easily available, cost effective, and also effective for use in animals. So the other one is Ashital. Again, this is available from Ashish Life Science. Easy to apply, 1 ml per 10 to 20 kilogram body weight. Subcutaneously given. It's not other route, subcutaneously. So for treatment of endoparasites also it's very important, not only ectoparasites. Ectoparasites. Even as to me, this is effective against endo and ectoparasites. But if you use ashimetrin 6% with the vaccine, more recommendable. In fact, this one is also very useful wherever you have and whenever you have the problem of GIT parasite problems, plus ectoparasite problems. It can be preferred. So that is available from Ashish Life Science Company. So that is what I have. Thank you very much. And if you have some questions, some comments,
yes,
I am available here.
I will take it forward, sir.
Okay.
Thank you so much for throwing some light on that, how we can identify this particular issues, even how we can have a best treatment and how we can diagnose it. So there are a few questions which I can read over here in question and answer. Like one question is asked by Mr. Patrice that he is practicing in Rwanda, and the question is that how economic importance of East Coast fever is only negative to animals like cattle. So as you can see, there are many loss of production is there in exotic cattle. So how we can see that it is only negative for animals or the cat?
Can I react? Can I respond?
Yeah, please.
Yeah. Just I want to raise the economic importance related to the animals. Animals affected means the community affected, the animal owner affected. Due to death of the animal, the main victim is not only the animal, the owner. Because the owner, they are breeding animals to gain something, to have some economic term from the animals. And just I raised the issue with regard to the animal. Otherwise, all those things are reflected on the animal owners. And animal owners, when victimed, the country victim. No question.
Yeah,
the animal byproduct reduced means the owner gain reduced. The owner gain reduced means the country affected. You see?
Yeah.
It's not only for the animal. Just I raised to indicate, to give the clue where the economic problem lies on the livestock. Otherwise, what he said is true. Human affected, the owners. Not only the owners, the consumers. Because the consumers are unable to get animal byproducts due to death of the animals. Cheese unavailable, butter unavailable, meat, so and so on, milk, so and so on. So The economic problem goes beyond the animal to the owner, from the owner to the consumer, from the consumer to the country level, even to the continent level, Africa, and to the world. The impact is changed, it's not only limited to the animal.
Yeah. And one more point, forget add, sir. Like as we were saying, see, this is the particular disease of, or the exotic cattle animals are more susceptible for this disease. And certainly there are subclinical infestations we can see, or the infection we can see in case of the domestic breeds, which are generally used for, meat purpose. So there might be one of that is the reason where there are the loss of production, especially the exotic animals are really rare for the milk production, and the zebu cattle, or we can see the domesticated or the domestic local breeds are kept generally for the meat purpose. So there might be that reason. So hope Dr. Patrice, or Dr. And Professor Shefferov has addressed your question. And thank you, Dr. David Natinel, because sir, they are having their class, MSc class, and they have a group of students. So they are attending our webinar from the class.
Thank you.
Yeah, and there is one more question. There is a anonymous attendee. He doesn't want to disclose his identity, I guess. Anyways, no problem.
No problem.
How can we determine the geographical distribution of tropical thylauriosis?
Tropical.
Yeah, tropical.
Okay. Tropical telluriosis, its geographical distribution can be determined, again, based on the vector hosts. It's not only Rhepicephalus appendiculatus. And during the presentation, let me go back.
Yeah.
What I said earlier. Yeah. What I said earlier, it's not only Rhepicephalus appendiculatus, the vector tick. It goes to the hyaloma and the other Rhepicephalus, Rhepicephalus zambensis, the Rhepicephalus dutoni, and even there are others suspected, which I don't want to make it confirmed. So hyaloma is common in the northern Africa, in Asian countries.
Yes, sir. In India,
in northern and Mediterranean region, in India, in China, it's common. That's why Telluria annulata is distributed in such areas. So the geographical distribution majorly determined by the vector tick. So that's why East Coast fever is not found in northern Africa, in many European countries, Asian countries, and in Mediterranean regions, because of absence of Rhepicephalus appendiculatus. But there is a risk for Mediterranean coast fever in eastern, central, and southern parts of Africa. It's not only for the northern. Being Rhepicephalus appendiculatus is existing, very, very high infestations are existing. So that is the vector will determine the geographical distribution.
Okay, thank you, sir. And certainly, Mr. Rashid, we can share this presentation for your future understanding and certainly for your reference. There is one more question by Sabiha that she's asking that are all Theileria species cannot penetrate the ova, or it is restricted to only some species?
Cannot penetrate the
ova of tick, ova of tick.
I couldn't understand what she
we were discussing about the trans-ovarian.
All Telluria species
can penetrate.
Unable to penetrate the ovary.
Cannot
of the ticks. All. That's why there is no trans-ovarian transmission. If we take Babesia, transstadial, oval transmission is possible, because in Boophilus species of tick, the Babesia can penetrate the ovary of the tick and can pass into the egg. Then the next generation can transmit Babesia to the other animals, trans-ovarian, because of the penetration. But there is no, maybe it is related to size of Tellurium. Otherwise, never penetrates the ova.
Okay, then can Ashimit, there is one more question that
Okay.
Ikezirim, certainly it should be addressed by me. Can Ashimetrin is used in pet dogs? Yeah, doctor, certainly the acaricides can be used, but see, we don't have any studies on dogs, but especially the methrins, we have, see, that is, as it is poor on, and nowadays in dogs, it is a spot on is going on.
Yeah.
But only you have to take care that the species which you are, applicating the medicine should not leak the drug because it is poison. And there is, yes, sir. Sorry, sir.
Certainly, application of acaricides should depend on the company when they test and the release. Just they release with a leaflet describing how to use the amount, the method, whatever. Unless we are having information from the company, care should be taken to not use for any animals. But for just, I'm confidently, for example, mentioned those drugs because I have seen them and it is used. I heard that it is effective from different professionals. Even if now I am not field veterinarian, I'm getting information from them. You see, there is a continuous contact with the field veterinarian. So it is effective. So care should be taken. We have to follow the instruction of the company, always.
There is one question from Dr. Roba. For vector control, especially, he wants to understand which is the most effective method for acaricide application.
Concerning season or concerning type of acaricide or what? Let me react in both ways.
Okay, sir. That will be good if you can react in both the.
Yeah, just let me try it out in both ways.
Yeah.
The best method of acaricide application is mostly we have to design strategic application. How we design up the strategic application, we have to know the seasonal burden of that specific tick. When the tick population is highly increasing and manifesting the animals, the infestation time when it becomes higher. So that should be the time to apply immediately. Concerning whenever the tick population is very high, we have to use the external applications of acaricide. We can use a spray, we can use a pour-on, but whenever the tick population is very high, spraying the animals, all parts of the body is the most important. After spraying, what we have to know, care should be taken. The animal to be not poisoned. We have to tie close to standing pole for a certain period of time till it gets some airs. You see? So we have to tie very short. Otherwise, we have to know when the season of tick is highly distributing in the area, high infestation of the animals. When we have to, based on that, we can design, but we have to take care of the animals also. When we are applying, we have to tie the animal just in short to avoid leaking by the animals, their body, their acaricide. I think that is the main. I don't know whether I addressed or not.
Yes, sir. One more important aspect is there, as ticks have a tendency to get hidden into cracks and crevices. So where we are, keeping our animals, so that area also should be clean, because tick control is not only because of the medicine, it's a managemental aspect.
Yes.
So that
Yes.
is to take care.
Yeah. Even sometimes, in our area, in rural area, what people are doing, sometimes when the grass gets very matured, not palatable for the animals, just they let wildfire to burn the area.
Yeah.
Then next, after just when the rain is coming, good and very palatable grass will come. But the ticks are eradicated with the fire, with the wildfire. You see,
Yeah.
this is how they are treating their animals. This is a local indigenous, but it's not in most areas. Some areas, and even I know in Walaita Sodo, when I was there is a dairy farm using Jersey breed. What the problem major in Walaita Sodo dairy farm is hurt water and other tick-borne disease, Babesia. There is a grass. During dry period, that grass becomes very dry. It's not palatable for the animals. They keep the animals indoor and they let wildfire to that grass, dry grass. Then after 2-3 months, it will recover. 3 months, a month maybe, not 3 months. After 3 weeks or a month, the grass will recover. Then they let the animals to graze. That is the indigenous knowledge. In fact, it's not by the professionals. So it's also possible controlling the grazing areas. Wherever there is no scarcity of grazing land, by rotational grazing of the animals, if there is ample land, grazing land, just by dividing the paddock, dividing the season, by rotating, you see. But the problem in Africa is, in Ethiopia, the basic problem is the grazing land. That is a major problem. Otherwise, it's possible also.
Yes, sir. True. Thank you for adding that knowledge, sir.
Thank you.
One more question is there from K. Kamanga, that can this disease be transmitted to humans?
Well, unfortunately, East Coast fever is not transmitted to human. No human cases is still reported.
Okay. And
if it is transmitted, if it is like that of trypanosoma, sleeping sickness, it's a major problem. You know, sleeping sickness in Western part of Africa is a major problem, but it's now also becoming Eastern Africa problem. It's not only West Africa problem. Now it is becoming East Africa problem. There is some report and some rumor from Western part of Ethiopia that sleeping sickness is observed.
Okay.
So it is a risk for East Africa also. But it is not, ECF is not.
But it's a good thing again that the importance of veterinarian may increase to diagnose those kind of cases again.
Where?
From across the countries where, you know, the zoonotic importance, whenever there is importance of zoonotic diseases, the veterinarian plays very important role to control the diseases.
Never come across. Yeah. I want to hear and I want to see this report. It's good for me also.
True. And one more question is there, sir. This, as we were discussing about the immunity via vaccination. So again, the anonymous attendee, he has asked one question that how long does it take for a vaccinated animal to maintain the immunity?
Well, maybe Dr. Chris Bourne can react to this one. He knows the vaccination practiced in Zambia.
Yeah.
Yes, Dr. Chris Bourne.
You want to take this question?
Yeah, thank you very much. Once we immunize the animal, we expect it to be immune to East Coast fever throughout its life.
Throughout?
So we just vaccinate once.
Throughout the life?
Yes.
That's long-lasting immunity.
It's long-lasting.
Yeah. But the problem is non-sterile immunity. That is a major problem.
Yeah.
It's not sterile. Just I tried to describe what is sterile and non-sterile immunity. Otherwise, as Dr. Chris Bond said, long-lasting immunity develop.
Yeah, just to clarify further on the immunity, as the professor said, we use an infection and treatment method. So we actually inject the parasite itself, the stage of a parasite itself, that has less virulence, and at the same time, we treat with oxytetracycline with the help of the animal getting that immunity, which is lifelong.
Okay.
Thank you.
Yeah.
As he just I mentioned, I know that's why I gave the chance for Dr. Chris Bond. In southern parts, they are trying to vaccinate animals, as he mentioned, infecting and treating. But my comment for those practicing infecting and the treatment, in fact, infection is with less virulent strain to avoid the clinical case. Rather than, with regard to treatment, rather than using oxytetracycline, I think it's better to use the drugs that I mentioned if Ashish provide to that areas. What I just come across in different literatures, oxytetracycline, it's effective, but it is not effective as those drugs. Just I'm not for advocating Ashish. Being the drugs are effective, honestly. Dr. Ahmad, please, he's laughing. Because I have to tell them the truth. The Butakur is the most effective. You yourself, Dr. Chris Bond, you try. Just importing, if it's not available in Zambia, importing, and you try with some animals.
No, actually we have it.
Yeah, it's very effective.
Available. Yes.
Yeah, it's very effective.
It's available, and we have tried it. It is effective.
Now most countries are shifting from oxy. Oxy is in fact it's effective, but it is not as Butakur. Butakur is the most effective. You try as just field trial, field experiment with few animals, in few animals.
Okay.
So with regard to the immunity, I think together with Dr. Chris Bond, we reacted long-lasting immunity, but non-sterile immunity.
Yeah. And there is one more question. As there is a swelling of lymph node, our colleague Dr. Edwin has asked one question. As there is a swelling, so usually people use diuretics. So is it recommended that we should use same diuretics in the thyroid cases to liquefy the swelling or the exudation part?
Diuretics?
Yeah.
You want to say that just to increase urination or what?
No, sir. Usually what happens whenever there is a swelling and once swelling is there, there is the exudation is there, few cell debris are there. So people, being a technical, people use diuretics where it increases certainly the urination, and while that urination, the swelling also goes off because it takes all the the liquid part of that swelling.
No. I think it's not related with this issue. It's quite different. The swelling of the lymph node is because of the accumulation and storage of those infected blood cells, lymphocytes majorly, trapped in the lymph node. So it causes inflammation in that area. That will increase the lymph node size. It's not fluid.
Yeah.
The tissue by itself, because of inflammation, swollen. It's a target. I can say it's a traffic light point. It's just like that. You see, whenever there is a red light, many cars will stop. Some will pass. Just the lymph node captures those infected lymphocytes, and that will cause increasing of the size. Otherwise, it's not related with what he said.
Okay. Oh, fine. Thank you, sir. And there are some praising also, sir, that the Thank you for your excellent presentation also from Dr. David National. Then certainly again, Dr. Merete also has praised your presentation. He liked the presentation. Thank you so much, Doctor.
Thank you.
Okay, and there is again this anonymous attendees is asking that whether the Moltrip, RTU, Dibinashish and Acetal, these are available. So certainly, Doctor, I don't know whether he is a veterinary practitioner or he is a farmer. So you can get in touch with Ashish Life Science. So we can let you know whether our products are available in Nigeria or not. But this is sure that he is from Nigeria.
Okay.
His identity is a bit revealed because of he's from Nigeria. Now, sir, can you just throw some light on the mechanical transmission? Any comments on the mechanical transmission?
For the mechanical transmission, flies, they have to play a role, but mechanically, there is no as such report. Mechanical transmission is possible, for example, in trypanosomosis. We know that mechanically transmitted trypanosoma vivax is common. But for Tellurium, Rhepicephalus appendiculatus is a major vector. Otherwise, mechanical transmission, I never come across and I never read any paper. Maybe Dr. Crispor, if there is some information in the southern parts, I don't know. Otherwise, I never come across, to be honest. And I don't want to mislead the audience with unclear information. Is there, Dr. Crispor, some information?
Mechanical transmission?
No.
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 What's clearly known is Rhepicephalus appendiculatus, because there is some development in the tick, developmental stage. The pyroplasm acid is never passed into the cattle. In the tick, there is development, kinates, and then it comes to the sporozoids. You see, there are some developments inside the tick. So to my understanding, and as also Dr. Crispor said, no mechanical transmission is reported from anywhere. And I don't think so.
Okay. Sir, there is one more question that what is the effective stage to control East Coast fever?
Effective stage?
Yes.
Majorly, it's better to break the cycle between the cattle and the tick, the Rhepicephalus. So breaking the cycle is the most important. Breaking the cycle is possible through application of acaricide. I apologize. Breaking the cycle is possible by application of acaricide, by controlling ticks in the field. The ones that we mentioned, indigenous knowledge, and controlling application or rotating animal grazing if grazing lands are available. But that is a problem, I think, in most areas. Otherwise, breaking the cycle is the most effective control method. Effective. Just controlling Rhepicephalus appendiculatus is a basic and effective control.
If I want to answer is like that, there are only two ways. One is the tick control, second one is use of the buparvacon, butacure.
Yeah.
So these are only the two stages. When you see ticks and when you see the symptoms, that is only when you can, start controlling the East Coast fever once it is diagnosed.
As I said earlier, also, it's a more sustainable and effective control is combination of the two.
True.
Just already I mentioned it earlier.
Yeah.
If my audience listens that, more sustainable and reliable method. Combination of strategic tick control plus vaccination. Vaccination as commented by Dr. Crispor.
Dr. Crispor can answer to this question. The next question is related to the vaccine only, that how it is effective, how effective is compared to the live vaccine, the control of East Coast fever, how it is very effective by vaccination.
Okay. Well, I'll talk from our experience, since we are just using the infection and treatment method. We have not really done the live vaccine, but the infection and treatment method, in a way, it's a live vaccine that we are giving, but only that we are treating immediately we infect. So this has been very effective. This method has been very effective against East Coast fever. But now, that's why I would agree with Professor, where he said, a combination of control methods is good, because what the picture we are getting, when we control East Coast fever, we start getting, other tick-borne diseases getting on the rise, like anaplasmosis, for instance, and babesiosis. So when we use strategic dipping and then immunize, that way we are actually catering for all the tick-borne diseases. So as Professor has highlighted, a combination of control methods is the most effective.
Okay. So Doctor,
just to add some pointers.
Yeah.
Can I?
Please.
The one mentioned by Dr. Chris Bourne is perfect. In live vaccine, the problem, one, in the rural area, remote area, there is a challenge of maintaining cold chain to ensure the quality and the efficacy. This is one. And the other one is it requires production of about 3 large batches of Tellurium sporozoites. And it does not provide complete protection against field challenge in all circumstances. So the one that gives complete protection against the field challenge in many aspects is infecting and treating the animal. It's already, Dr. Chris Bourne said it. But the challenge to keep cold chain, to keep quality and efficacy, again, production. It requires production of 3 large batches of those sporozoites. And even it does not give complete protection. That's what I said, against that of the field challenge. So the effective one is the previous one, which is mentioned by Dr. Chris Bourne.
Okay. So Dr. Chris, just for my understanding, you are giving the challenging the East Coast fever at the same time, and the medication also is given on the same day or after a gap of few days?
No, it's the same day. So
Okay.
what happens when we are on?
Sorry, you are not audible properly.
Oh, okay.
Yeah.
Am I clear now?
Yeah.
Am I clear?
Yes.
Okay. So the same time we give the vaccine around the paroxysmal lymph node, we also inject with a tetracycline. So that completes the infection and the treatment.
Okay.
Yes.
Okay. Probably this will be the last question which we are taking. See, there is one question from Paul, that does the male ticks suck the blood and transmit the Tellurium species?
Taking the blood?
Yeah. Is it only the male ticks is responsible for it, or if the female also is equally responsible?
So what we said earlier, the larval stage, the nymphal stage, and the adult stage, they are the one to transmit. The female, maybe after taking the blood, drop for egg laying. Otherwise, it's not like that of a mosquito. Maybe he is just trying to compare with mosquito. The female mosquito is the one that plays key role in transmission of malaria. But here, both can transmit because they are taking blood. But the stages, the larval stage, the nymphal stages they are playing key role when they are taking the blood. Otherwise, no differences. It's not like that of mosquito.
True. So with this question, I guess, sir, we have completed the questions. Most of the questions we have addressed. I guess all the questions we have addressed wherever our attendees were having. Now, I would like to say to Dr. Chris Bond, if he has anything in mind or anything to talk on this webinar, because this was specially, on his request, we did it.
Yeah.
Yeah, Dr. Chris Bond, to you.
Yeah,
Sir, your again voice is not.
Just voice.
Oh, the
Voice,
voice?
Dr. Kispo. Yeah.
okay. Is it clear now?
Now
Clear.
Okay. So I just wanted to add just a few things in relation to the distribution of East Coast fever in Zambia. In Zambia, I don't know how it is in other countries. The Tellurium parva has actually two subspecies. The first one is Tellurium parva, which is distributed around eastern Zambia. And the disease is actually classically called East Coast fever. Then in the southern parts of Zambia, we have a subspecies called the Tellurium parva lorenzi. And the disease there, though East Coast fever, but here locally we are calling it corridor disease. So we have two distinct sort of disease complexes that come from the Tellurium species. And because of that, this also affects how we allow movement of animals, because we are, avoiding having across other concoctions that would come from this complex. That was just my addition. Then secondly, just wish to thank Dr. Amadip for actually making this request come to fruit. And we would also like to extend our thank you to Professor Daisy for this beautiful presentation that has given us a good picture on East Coast fever, or rather on theluriosis, actually the world over. I'm sure most of my colleagues, including me, we were just restricted to Tellurium parva, but it's good to also get some understanding on Tellurium annulata and its distribution, and also other related diseases. So thank you so much.
Thank you so much, Dr. Chris Bond. And with this note, I would like to thank to all the participants, all the attendees for making this session. And last but not the least, our speaker, sir, thank you so much, because it's always nice to hear it from our professor. And we are again feeling it that we are back to our colleges and taking a lecture from our professor. So Professor Daisy Shefe Rao, thank you so much, sir, for giving us the time, and within this short notice, it was very good session, sir. Thank you so much. And the session will not be completed by, if I will not take the two names. The most important name is our IT, Mr. Sandeep, that he has, make this platform available for us. And the another person is our digital lady, that is Smita, who made this digitally viable for all of us to talk on this one. So the last portion is that we will have, as attendees were there, so we have a special surprise for all of them. Like we have a Wheel of Fortune. We all know that Lucky Dip is there. So we have an online Lucky Dip, the Wheel of Fortune. So Smita will do that. And let's see who are the 3 lucky winners are there. It might be from across any country. So we will, we have our people over there. So they will come with some of the goodies. And let's hope for the best. The good participants will, all were good, but best of best should win this. So thank you so much, sir, for attending. Yeah.
Thank you so much.
Sir, if you want to share anything, sir. Okay. Now,
thank you so much for your invitation, and we will meet again in another topic.
Sure, sir. Now let's see our first winner. So Kennedy Munian. Sorry, I'm not able to say this. So
Muniania.
That's
Munian.
Kennedy Muninya from
Yeah.
Zambia.
Oh,
Zambia.
so very good that he's our first winner, the lucky fellow. Now let's see the second one. So congratulations. So the second one is
Onyaka Asuzu.
Ka Asuzu.
Yeah.
He is from I don't know which country that, but we will come to know once we take the data of attendees. So we will come to know, and also we will make it digitally available. So don't worry. And the third winner will be. Hope it should be my name. Okay, Rajab Awami. So congratulations to all our three winners. Can you show the 3 in 1? So just for everyone, these are the 3 winners of this webinar. Yes. We will make it also available on our digital platforms. तुझे फोटो काढ लेना दे मला. So the first one was Kennedy Munianya. Second one was Onyeka Asuzu, and the third one was Rajab Awami. So congratulations to all of you 3 guys, and soon my colleagues will come to you, whichever countries you are from, they will come to you and they will give you some the goodie bag. So thank you so much for making this session very active, live. You guys were very interesting to ask the questions, and moreover, it is again a knowledge sharing platform of ALS. And we will again, on behalf of ALS, I would like to say this thing, that we will continue this session again and again, because knowledge gaining is never ending process. So thank you so much everyone for giving your time, spending your time for ALS and for this knowledge gaining session. And I guess, sir, again, lastly, sir, I would like to again extend my thanks again to Dr. Mereba, the Dr. Daisy Shefera. And thank you, Dr. Chris Bond and the team. So thank you so much for making this live. Thank you so much.
Thank you.
Thank you.
With this note, we will end this webinar. Thank you so much.
Thank you.
Thank you.
Have
Have
a
a nice
great day.
Have a nice time.
Have a nice time.
Yes, sir.